will die within the first year that they're born. So there's a picture of the rash from rubella. So they all look pretty similar of the measles. Fungus can cause diseases of the skin. Fungal diseases are called mycosis. Cutaneous mycosis are the fungi that caused by the fungi that grow on hair, nails, and the skin. They're growing on that keratin in the skin. They also are known as dermatophytes, or tinea, or ringworm. So these next B through E, that isn't the genus and species of the fungi, that is the condition. So tinea capitis means that you have ringworm of the scalp. You get it through contact with fomites that have the fungi on it. You get it from dogs and cats. When I had it, I got it from the cat. Tinea crurus is ringworm of the groin, also called jock itch. Tinea pedis, ringworm of the feet, or athlete's foot. And tinea corporus is ringworm of the body. So you need to know these different tineas and where they infect on the body. Here are the genera of the fungi that cause ringworm. Trichophyton, that one infects the hair, skin, and nails. These are ones that cause skin disease. Mycosporum, the hair and skin, and epidermal is the skin and the nails. So treatment is topical drugs. You can take oral drugs, that oral griseofulvin, but that one has serious side effects. So if you're taking fungal drugs, then you have to go in for liver enzyme tests, because the fungi, has the same cell type as who? A fungus has the same cell type as who?
Oh, might go back to me.
Fungal life,
It's the same cell type that you have. So when we're treating the fungi, they're both eukaryotic cells. It's not like a bacteria. It's a different cell type. So we can target a bacterial cell, and we don't have too many complications from that, just killing off a bacteria and overgrowth of yeast. But if you're using a cell, if you're treating the same cell type that you are, then it causes more side effects for you. And they're pretty potent drugs. There's a picture of a dog with ringworm on his legs. There's an actual ringworm on somebody. And that guy is in trouble.
Wow.
That looks like tinea corporus. It's all over his body. Subcutaneous mycosis, those are more serious. These fungi usually inhabit the soil, and they get through the skin by a wound. The most common disease is called sporotrichosis, and it's caused by the fungus Sporothrix schneckii. It's a dimorphic fungus. That means that it can live in two states. It can be a yeast or a filamentous mold type thing. It forms small ulcers on the hands and enters them through the lymphatic system. Candidiasis, overgrowth of yeast, and it's caused by Candida albicans. You can get this if you're on antibiotic therapy. It can cause vaginitis, because your yeast and your bacteria live in harmony on your skin. And so if you take antibiotics and you kill off your bacteria, then the yeast can overgrow. Also see it as thrush, that's in your mouth, especially in newborns, because they haven't developed their immune system yet, and they don't have normal, they don't have the normal microbiota. Also see it in immunosuppressed patients, people that are obese, maybe have folds and the candida can grow in that. And diabetics are prone to yeast infections as well. There's a picture of it, of a thrush, the yeast growing on the tongue there. There's parasitic infections of the skin. One is called scabies, caused by the mite Sarcoptes scabiei. And it burrows under the skin to lay its eggs, and that causes itching. It is transmitted by direct contact, including sexual contact. And treatment is with topical and oral medications. There's about 500,000 people that are treated for scabies in the U.S. per year. The mite lives for about 25 days. Diagnosis is microscopic examination of skin scrapings. And they have topical and oral medication that can be taken for scabies as well. So here's a picture of what it looks like, you know, the rash that's on the skin. There's some mite that causes it. I've got a better picture here. Those are skin cells, and you can see the mites that are buried down in those skin cells. They look like, I think a mite looks like it's something out of Star Wars. Yeah. Pediculosis, that's when you get an infestation by lice. The head louse is called Pediculosis humanus capitis. It infects the head and neck, and it attaches their eggs to the base of a hair shaft. And this one, kids can come home from school with this. My son, one of my son's daughters came home from school with it, and they have long, thick hair, and the mother has long, thick, curly hair, and he was, you know, had to have a what are they called, knit combs, and combing that hair and getting the stuff for the shampoo, and yeah, it's a big pain if you were to get it. The body louse is Pediculus humanus corporis, and it's only the body louse that spreads disease, and the disease is epidemic typhus. So that louse need a blood meal from their host several times a day, and after several weeks of the louse feeding off of you, then you become sensitized to that louse's saliva, and then you get itching and you're scratching, and at that point you can, if you're scratching, you can get a secondary bacterial infection from your scratching. There's a picture of the head louse. This is Pediculosis pubis, infects the pubic area. And in that photo, there's a bunch of lice and nits. The nits attach, you know, to the hair. That's the egg. Here's another picture of a louse nit. It's an egg, and this is called the operculum. And when that louse is ready to hatch, that opens up like a little door, and out it comes.
I'm getting itchy.
The eye, this is just showing you normal eye. Normal flora is Staphylococcus, but there's not much. You have defenses against things such as your tears Your tears contain lysozyme, your blinking, and to keep things out of your eye. We have diseases of the eye. The conjunctiva is the mucous membrane that lines the eyeballs, and it is, or I'm sorry, the eyelids, and it is the outer white surface of your eyeball. It's a transparent layer of living cells that replace the skin, so it's kind of an extension of your skin, and it's a portal of entry for microbes. So here on the top is a normal conjunctiva, and down here you can see it's all red and inflamed, so that one is has conjunctivitis. And conjunctivitis can be caused by bacteria. You get inflammation of the conjunctiva, also called pink eye. So the pathogen the bacterial pathogen that can cause that is Haemophilus influenza. It's the most common cause of bacterial conjunctivitis, and it is found a lot in soft contact lens wearers. They get this infection.
I had that one. I had a cotton.
Neonatal gonorrheal ophthalmia. The pathogen is Neisseria gonorrhea. That's the pathogen that causes gonorrhea. So if the mother has an active case of gonorrhea and the baby's coming down that birth canal, it can pick up that bacteria. And if the baby doesn't get treated, then large amounts of pus can form and can cause ulceration of the cornea, and it can lead to blindness. So they used to put in a 1% solution of silver nitrate when babies were born. They all got it. And now they've changed that to just to antibiotics that they put in there. But we are going to be doing some work in lab where you're going to be doing your core plates where you're putting different types of bacteria in it. And then we're going to put some little discs that have been dipped in silver nitrate and other chemicals. And we're going to check to see if it inhibits the growth of these bacteria. So we're going to be using that in lab. Here's conjunctivitis from Neisseria gonorrhea. Also can be caused by Chlamydia trachomatis. It's vertical transmission, meaning from mother to child. We have bacterial species that cause it, and viral species as well. There's another picture of a neonatal gonorrhea ophthalmia. Inclusion conjunctivitis. The pathogen is Chlamydia trachomatis. It is bacterial, and it's an obligate intracellular parasite, so it has to live inside of your cells. This gets transmitted by going through the birth canal. You can pick it up if you're swimming in a swimming pool that isn't fluorinated. This one, though, resolves spontaneously and rarely causes scarring at the cornea. You can treat it with tetracycline eye ointment. Trachoma is a more serious bacterial infection. It's caused by certain serotypes of Chlamydia trachomatis. It is the world's leading cause of preventative blindness. It's caused by an infection, so you need to know that. This one gets transmitted by direct contact, by foam mites, by flies. Flies also can land in your eyes. You see that a lot in deserty